We have a panel session now. I'd just like to say a few final words to our winners, though, while they're setting this up. You might like to, our winners of our awards today, you might like to remember the wise words of the late, great Bob Hope when he too was awarded by his peers. He said, "This award makes me feel humble, but I have the strength of character to get over it." Or you might also like to remember the wise words of the late, great Jack Benny. He said, "I don't deserve this award, but then I have arthritis and I don't deserve that either." This brings us to our final really important and exciting session, and that's our panel session. And to facilitate this session, I'll ask Karen to come back on stage, please. Just give her another warm welcome on stage.
Fortunately, you're not going to have to listen to me the entire time for facilitating this session, and at some point very soon I will handball to Ken. But I think just to set the scene, we have had, and you've probably read the publicity around our nurse workforce survey. So a big response, more than 2,000 people have come back to us in our nurse workforce survey, and 50% of the people that were surveyed said they felt as though they could do more complex and more rewarding tasks in their workplace. And of the people that went to actually ask, half of them had asked if they could perform more in depth, more complex, and certainly some more stimulating type of skills in their workplace. At least half of them were told, no, you couldn't. I mean, the good news is that roughly half of them did go on to do more things. But we still have this huge swathe of the nursing workforce not being able to work to the level of skill that they're trained for. We're looking at new healthcare models. So models of care for healthcare homes, patient-centred medical home, and they're all using building blocks. And we're talking about building blocks here today. And one of the aims from those studies using the Bodenheimer building blocks is a quadruple aim. And there's better patient outcomes, very good things. But the last aim is looking at workforce satisfaction and workforce retention. And we know that if you're happy and well recognised in your workplace, that you're more likely to stay. Nurses want people to see them, they want to be valued for the work that they do, and they really want not just they want their peers, but also the public to understand what type of contribution they make and how valuable that contribution is to workplaces. Having a nurse in the team actually allows businesses to expand the number and type of services they can offer. But often, because of the current funding system, that's not well recognised. Fee for service, some people go, we want more item numbers, but that's not a good thing because then you get trapped in doing tasks attached to item numbers. And the bulk funding that comes to practices now, some practices are using it very innovatively and amazingly, and we certainly have some very good examples of that in our nurse-led clinics over the past few years. But sometimes it just goes into consolidated revenue and nurses are told that they're not working hard enough or they're not contributing to the bottom line. But every time a nurse sees a patient to do a workup and then hands that patient to the GP, there's a business case. The GP has seen 2 sick people while the nurse has done that build-up. So our hope with the 2022 strategy is to look at how we can change the perception of the type of work and the value that nurses bring to their community settings, the places where they work, whether it be community setting, a general practice, a prison. But nurses they want their peers to understand what they do. They want to be valued for it, and I think visible, valued and respected will be the catch cry that you'll hear over the next few days. So what I might do now is hand to Ken, who's going to actually chair the session, and he's got a few words to say about the strategy.
It's always that awkward moment when you step onto stage and you go, is the mic on? So a quick bit before we get into the panel, because we're going to today be launching a 4-year campaign that APNA is going to lead and we're going to get your support for. We're going to talk about the campaign of Nurse 2022. It's a campaign that's 4 years long. The idea is that we build support over that time in order to start making changes in your day-to-day work life, but then also policy changes as well. And I know that when often we talk about policy, it's very easy to get lost in the rabbit holes because we've seen policies come and go. But it's our time right now to actually influence those policies so we can get those changes that we talk about. So Karen mentioned those 3 words with valued, visible, and respected. And when we looked at the results of our workforce survey, it was very clear that the messages everyone was giving us there, and there was over 2,000 nurses who completed it last year. There was a sense of both frustration and there was also a sense of hope about what could happen if we were to actually start creating some real change, not just in our local areas and in our clinics and in that day-to-day area, but also setting that policy environment that would enable that to happen. So how are we going to start this campaign? And you're getting the sneak preview today because we'll actually be launching the campaign on International Nurses Day next month, but we wanted to take this opportunity to really start getting a lot of nurses heads around this campaign and to get a sense of what we're going to be doing over the next 4 years to improve that level of value that nurses have within the health system, make sure that you are visible, make sure that you are respected for everything that you bring. It's very hard to do that when you usually work one-on-one behind a closed door in the settings that you work in. It's very easy sometimes for a policy announcement to involve a hospital because it's a very visible thing for the public to see where their tax dollars are going to. It's hard to say we're going to actually increase the capacity of a workforce. You've told us very clearly that in your day-to-day practice there are certain things that sometimes they're just a little bit frustrating. Sometimes it's actually a bit soul-destroying. Sometimes it just means that you can't help as many people as you would like to. And at APNA, of course, it was always about a healthier Australia through better primary healthcare nursing. But as Karen so well illustrated, when 50% of you are being told that you can't work to your full scope of practice, that isn't an efficient way to get us to a healthier situation in Australia. So we're going to do 2 things as part of this campaign, and we'll give you more detail throughout the conference and we'll talk about it more with the panel in a minute. But we're going to start with several things, and one will be actually APNA supporting you to make changes in your day-to-day work life. We can't be there to help you ask for a pay rise or to actually challenge some of the status quo that needs to change if you're going to work to your full scope of practice, but we can support you. So we're going to be putting in place a number of dedicated programs and materials that we'll be developing to help you with that. We're also going to start linking you in a bit more so you can speak to each other. It's great when we're here together at the conference, there's so much energy here, but when you go back to your workplaces, often you're isolated again and it's pretty easy to lose that momentum that you gain when you are with so many others that are doing the same thing as you. So we're going to help reduce that sense of professional isolation you get as well. We're also going to make sure that we are publicising the role of all of you and what you do, and we're going to be ramping up those efforts to make sure primary healthcare nursing is visible to the community. And just a thought about that. We had a dinner last night with a number of politicians and a number of stakeholders and people from the Department of Health and that kind of thing, and I mentioned that there were 82,000 primary healthcare nurses, and I got this very startled response from the audience because I didn't think there was that many. So what I want you to just think about is, imagine if for the first time we were able to get all 82,000 primary healthcare nurses thinking as one, and importantly, speaking with one voice. It's very easy for us to divide ourselves. And it's very easy when we are divided to actually splinter the message. And the core messages we need to get to our policymakers, that we need to get to our employers, that we need to get to the peak bodies that we have to interact with every day to change our health system. If we can speak with one voice, we can be immensely powerful and immensely influential to make that change that a lot of us have been talking about for a long time. So I want to talk about some of the things that we think we can achieve in the next 4 years with the panel that I'm about to introduce. Great panel, you're going to notice some familiar faces, and we've chosen people from different areas. So I'll get the panel to start coming up. Hopefully your mics work first time when you step onto the stage as well. So I'd like to introduce Chris Helms, who is a nurse practitioner. Some of you who were at the conference last year remember him. He was the winner of the Rosemary Bryant Award, so welcome, Chris. I'd also like to introduce Tracy Johnson, who's been at a number of our conferences. She's the CEO of Inala Primary Care and was actually a recipient of the Winston Churchill Memorial. And she's been, a lot of you remember her from our conferences, bringing back a lot of ideas about different models of primary healthcare from different countries. So welcome, Tracy. We've also got Jackie Eyles, who's a registered nurse from Jindabyne Medical Practice, and someone who we think is a great person that we can model a lot of our inspiration for Nurse 2022 off. So welcome, Jackie. We've also got Tony Hobbs, who loved being on the board so much he returned to it in the last 6 months. Tony is obviously on the board, but and is a general practitioner, but has also recently been the Deputy Chief Medical Officer for the Commonwealth Department of Health. So welcome, Tony. Thank you. And then I'd also like to welcome back to the stage Karen Booth, who you know well and doesn't need any introduction. So welcome to the stage, Karen. So we're talking about Nurse 2022, so I think the obvious question, which I'd like to throw over to the panel first, is what do you think nursing in primary healthcare can look like in 2022?
I'll start off. I never like to start, actually. I like to listen to other people and reflect on that. But for me, in 2022, what I would like to see is what I saw when I was working at a general practice in Campbell, where the funding was disaggregated from the scope of practice. And what that allowed was primary healthcare nurses to actually work to their full scope of practice, where there wasn't this concern about, well, I've seen the client, I've implemented a provisional plan of care, but we still have to have that general practitioner to see that client so that we can actually generate that funding. And I think that what was actually quite encouraging, and what I would like to see in 2022, is this idea that being an advanced practice nurse is really, at its fundamental core, working to your full scope of practice, working to the very limits of your scope of practice. And that means that you, as a registered nurse, as the nurse that are seeing the client in front of you, it's actually okay for you to see the client, create a provisional diagnosis, a nursing diagnosis. We're not going to get into the language of medical versus nursing diagnosis, but see that client, provide a plan of care, and then discharge them from the service, thereby increasing efficiencies for that service. There are gains to be made by increasing systems efficiencies, and I think that right now we are all, whether you're a nurse practitioner, whether you're a registered nurse or enrolled nurse, we are all facing huge inefficiencies because of the way that we're funded. And I would like to see the recognition that we can actually see patients independently under our own scopes of practice, discharge them, and actually generate efficiencies in the system that drives the system forward.
Thanks, Chris. And I imagine, Tracy, you've got a few words to say about inefficiencies in healthcare.
More than a few. So my vision for 2022, it's not on. Is it now on?
Is there a button? It says green.
It's green.
It's green. Okay, maybe we'll give you the hand.
So my vision for 2022 is that we will have triple the number of nurses at least that we currently have in primary care. So if we've already got 82,000, that's a pretty bold vision. The reason being that at the moment when I go into general practices, when I go into prison environments, when I go into a bunch of healthcare settings, what I see is an RN if I'm lucky. What other parts of the world have already done is they've got nurses at different levels, so they'll have enrolled nurses, they'll have registered nurses, they'll have registered nurses with different and special interests that are specialists in that field, they'll have nurse practitioners, they'll have all sorts of nurses that have real and viable career paths exciting and attractive roles who are well respected by the patients and the colleagues that they serve.
I don't know if mine's on either. Yeah. Can you hear me? So my vision for 2022 is that nurses in general practice feel as valued as their tertiary counterparts, not only within nursing itself, within their communities and their workplace. I've met many nurses by being involved through APNA, but often the thing I hear is, I just work in general practice. And I don't want to hear, I just work in general practice. I want to hear, I work in general practice, and be very proud of what you do, because it is a specialty. We have an avenue to grow and change what we do in our nursing in a better capacity than our tertiary counterparts. We have an amazing group of people here today with fantastic vision for the future, wonderful things that are actually happening right now, and we're not properly recognised for it. I know when I was recently asked at a high school catch-up, what area of nursing did you fall into? I run a sexual health clinic, so my answer was, I fell into genitals. We have to recognise the amazing things we're doing, but stay light-hearted, stay approachable, because a big part of what we do is connecting to people. Just in case you need that.
So not surprisingly, I would say look at your community's needs and how nurses working as part of a team can actually meet the community's needs. And it's really important that Karen referenced the bottom-high model. So the first two parts of those principles are about patient outcomes and patient experience, putting our communities at the centre of everything we do. The sustainability of the system should really concern us all, and of course as health professionals, our experience, so that we can be the best that we can as part of that team. And wherever nurses are working, whether that's in remote Australia, whether it's here in central Adelaide, whether it's in a general practice, a community health setting, in an aged care setting, in a justice health setting, wherever we find one of those 82,000 people, it's them working to their full scope and competencies so that they can best look after that person that they're delivering care to as an individual, but more importantly, as part of that community. Nurses can't do that in isolation. You can do that when you work together as nursing professionals, and I think strategic partnerships are going to be really critical to that. But also working together as part of a broader primary care team. So that's nursing, allied health, it's doctors, all of us working much more efficiently, much more collaboratively, supported by a funding model that not only enables that, but incentivises that. So that's what I would like to see for 2022.
Thanks, Tony. And Karen, your thoughts?
I'm having what Tony's having. I think that currently we do have these amazing health professionals with a lot of skills that they're just not utilising, and they're constrained by the current funding models. I also think there needs to be better recognition of funding that does come to the practice, so that those bundled payments that come for nurse support just to sort of subsidise the activities, they're actually meant to subsidise nurse activities, not go to consolidated revenue. And practices over time have become much more reliant on those payments, particularly with the Medicare freeze, and there hasn't been sort of much of an increase in income. So it's very easy for practices just to suck that up and keep the nurse ticking over as business as usual, particularly if they want to sort of go high turnover. So I really think it's important that we look at funding nurses so they can do what they do, so then doctors can then move on to do what they do. Not every patient needs to see a doctor. Most of the patients I see in a day don't really need to see the doctor, but it's just the funding model that the doctor has to pop in. And you know, and I'm sure you'll all had the conversation where, can you pop in and see this patient? Oh, right, I'll be there in 10 minutes. And really, they really didn't need to. And the other thing I'd like to see in 2022 is that there have been lots of research done on actually how nurses fit in and how they contribute to efficiencies of practices.
Great, thank you. So if we think about 2022, we'll be in a aged care Royal Commission environment with everything that entails for our everyone working in aged care. We'll have the ageing population just generally, even those not in aged care, sort of that little bit older. We'll have the chronic disease burden increasing as it's going to. What do you all see as being absolutely vital for nurses as individual professionals to be prepared for in 4 years' time?
I might go first. Is this working now?
No? Okay.
It's still green. So in 4 years' time, my plea to nurses is be the change you want to see in the world. Mahatma Gandhi said that first. And one of the things that I see nurses doing way too often is saying, can I do this? Could I possibly, please, if I'm really nice, do that? Instead, what we need to be doing is developing the business cases, putting up the proposals, and frankly, sometimes just doing it, as Nike says. Just do it. Show that it works. Gather your own data, develop your own systems, take responsibility for your own professional development so that you can deliver awesome care. And people will eventually, after a matter of weeks, days or months, go, hang on, I couldn't do my work without that person doing their work the way they do it. So you've proved your business case in action. So don't sit silently, don't wait and ask for permission. Occasionally you'll need to ask for forgiveness, but more often than not, you just need to wait for the plaudits to come.
Thanks, Tracy. Jackie, do you have any thoughts on that?
I guess I just agree with what Tracy says on the just go for it. I'm a prime example of how well just going for it can work, although it's not directly related to aged care and the ageing population. I did it with a youth demographic in a small, remote, rural town in a ski resort, where I spoke to my communities and I continue to go into the schools and speak. I don't get paid for a lot of what I do, but I'm passionate about my community. There's been times where I sit in my car and cry because I feel quite alone and not sure where I'm going with it. But if you can speak to the people in your community and gauge what it is that they would like to happen for their health, because we can have these amazing policies, procedures, protocols, but if it's not suited to the demographic that you're dealing with, then I don't think it's effective. You're not going to be able to wait to receive funding. My husband and I got the children a Happy Meal and went into a sex shop in Fishwick and bought the first pack of 1,000 condoms to tell people about the clinic that I ran, and my children sat around the dinner table sticky taping condoms to business cards, don't tell my grandma. And when they were asked what it was they were getting involved with, I said, these are balloons for adult parties. And my 5-year-old at the time said, I hope I get invited to one of these adult parties one day. And I said, well, be sure to pack your balloon. So there's a little bit of education there for even a 5-year-old. Know your audience. Speak to people, get out in your community, and what you do will be tailored. Yes, it's going to cost you emotionally at times, financially perhaps, but what I've got back from that and what my community's gained from that is beyond anything that I could have expected. Just have a go.
Thanks, Jackie. That's a really powerful story. And one we won't forget, Oda. And Tony, maybe from your view, which is fairly unique for the panel, what do you think the nurses need to be prepared for in 2022 if they're going to meet those healthcare challenges?
So there's a couple of things. On foot at the moment, the Royal Commission into Aged Care, Safety and Quality is a really important opportunity for the whole of the health system, but particularly for nurses, I would say. So out of this, we're going to hear lots of awful tales, unfortunately. But we have to remember behind that, there's a whole host of people trying to do the very best to look after this very aged, complex, very frail cohort of people in residential aged care and indeed in the community, of course, because it's looking over both. There is an absolute opportunity to look at new models of care, better models of care, moving forward to better look after that cohort of people. I see nurses as absolutely front and centre of that, including nurse practitioners. So I think that's a really important opportunity, and it'll be really interesting to see how that plays out over time. I think sitting right alongside of that, of course, is the increase in dementia. So already in this country, we have about 460,000 people with dementia. By the middle of this century, that's going to be over 1 million. It's already the second leading cause of death and the leading cause of disability in older people in this community. There is a huge opportunity for nurses working as part of a team to have better, timely diagnosis, so not 3 years from first symptom, but much more quickly. The time around the diagnosis, supporting people, linking them up. I'm thinking of the work of Christine Phillips, the agent of connectivity, helping that individual, their care and families to link up with the supports that they really need right now. There's a huge hole there. And of course then end-of-life issues where nurses can work as well. But we mustn't just talk about that spectrum. I'm also thinking about the first 2,000 days of life, our registered nurse midwives, how important perinatal care is. I'm thinking of nurse immunisers. That is such a potent primary preventative thing. Nurses running immunisation clinics, well women's clinics, all of those sort of prevention work that nurses can do when they're enabled and supported to do it. So they're the sorts of things. I think there's a whole lot of opportunity, I think, not just in the complex comorbid space, even though that's very important, we mustn't forget those other spaces as well.
Great. And Karen, we'll get the microphone back across to you. It's great that our nurses share so much. It's great.
It's my exercise for the morning. Look, there are a few things, and I think Tony touched on aged care in particular, and we know that apart from the quality of care that registered and enrolled nurses bring to aged care, if they're adequately staffed, they're also supervising and teaching. And I think that they've been cut back to the bone, that the assistants aren't getting enough support and teaching that they need to actually give correct care either. And also, I think, by 2022, I'd like to see more meaningful use of the data that practices collect to actually apply it to population health planning for their communities. Currently, we feed data off to a whole pile of places, to the immunisation register, to the PHNs are collecting data. That's all going to end up in a big data set that'll form a national picture. But I don't think there's enough emphasis going into practices around, well, you've got 250 diabetics and another potential 100. How are you going to manage getting those people in? So to see that more meaningfully applied. And then the other thing I'd really like to see is more meaningful coordination of care through general practices. And I think we're kind of moving there, but no one still has a really good idea of doing that. There's very little protected time in practices to do that. So I think if we're going to talk the talk, then we need to walk the walk and actually make sure that there's time for nurses to pull that together for the patient, and then it also makes life easier for the other team members around them who are contributing to that care, the GP, the allied health who contribute to that care.
Fantastic, thanks Karen. And Chris, maybe throw back to you. What do you think is a realistic way that on a practice level or in a clinical setting level that nurses can take proactive steps to increase their scope of practice?
Okay, so on a sort of operational, sort of pragmatic way of approaching this, I think number one, we as a profession need to start giving us permission. I think that was mentioned before. We need to kind of relieve ourselves of the shackles of what we think the scope of practice of a registered nurse is, and actually really challenge convention and really think, okay, well, what are examples around Australia internationally that have been successful, and really actually start learning the language of actually looking into these reports that are being published and saying, well, this is what the experience is. And I got to say, one of the skills that we need to learn by 2020 is that each and every one of us needs to be able to sit down and read these reports. And I can tell you right now, for me, it was never easy. I had to actually sit down, read these NBS reports, let them marinate for about a week, and then go back and then read for comprehension, because it is something, it's a skill that you have to learn. And so I guess when we talk about achieving our goals for 2022, I suppose in a realistic, you need to keep the patient at the center of care. Every decision that you make, you need to be figuring out, well, what's the patient's experience? with the example of the Aged Care Commission, you know, we need to be thinking about, well, what could we do? We nurses are really great troubleshooters, but we're afraid to open our mouths, and sometimes we feel that we're not qualified to open our mouths, and maybe we're afraid of looking stupid. But I have to challenge that and say that actually you guys have a lot of great ideas, and we all have a lot of great ideas, and you just need to start learning the language, opening your mouth, and exploring what is happening at a local level. First of all, what is the patient experience locally in the aged care facilities? Is there a better way, is there a smarter way of working that can actually bring me out of my shell and push me to learning one skill set and one area of expertise, and then really nailing that down and then growing into another area, and every single day going to work thinking about something else that you could actually take away and read more about and learn more about to increase your knowledge and your scope of practice.
And probably a really nice segue to Tracy. Tracy, you've spent a bit of time travelling the world looking at different models of care, and what comes to mind for you as we talk about 2022 and different things that nurses could be doing that can change the model of care that they're working within?
I'm actually interested in 3 days ago as well. So, you know, how does 3 days ago when the budget came down prepare us for 2022? Yeah. So one of the little silent announceables in that budget was that enrolment is now going to be funded for certain populations in general practice. That sets us up in ways that we have never had before, because it's truly national, to actually be able to enrol target populations and free ourselves of the burden of patients in general practice having to see a GP. We can now provide telephone care, we can provide care coordination, we can provide education and a whole range of services in new ways to those groups, because we're now, for that target group, going to have enrolment and the capacity to fund it. And I don't think anyone's celebrating it, but I am. I think it's awesome. Enrolment needs to happen. I think in terms of the future, I also see that things like the healthcare home model that's in pilot will expand. So in 4 years' time, I'm optimistic. I think that whilst the program will change, the name will probably change, because these things always do, the fundamentals of having patients that we take responsibility for, we don't just react to, we take responsibility for, we plan their care, we look at them as populations, we organise defined models of care rather than just it's a GP that sees a patient and occasionally the patient sees the nurse. It's about, well, what do we do with our frail elderly? What do we do with our mental health patients? What do we do with all of these things? Which then creates enormous opportunity for specialisation in nursing. If mental health is your thing, again, in the budget 3 days ago, enormous investment in mental health. Go for it. Find ways to serve that need differently. Beyond that, I think QI-PIP, it'll come in 6 months' time as a big change. There is enormous potential for those prepared to step up, because practices are going to be changed in terms of the way they're funded. So find the way that you as a nurse can make that QI-PIP deliverable easier, make it better for your practice to get more and more money, because that incentive payment will again evolve over change, and without amazing systems, good registry management, comprehensive care being delivered, preventative health being addressed, practices won't meet those QI-PIP evolving targets. So this is your time. Embrace those changes that are already in place, and by 2022 you'll have quite a different work environment.
Fantastic, thanks Tracy. Yeah. So we've got a couple of microphones going around. We've got time for a couple of questions from the audience. If you care to raise your hand, will the people with the mics please raise their hand, and then you know where they are, and maybe if you raise yours, they can get to you quickly. So are there any questions for the panel from anyone on the floor? See, it wasn't this quiet at drinks last night. Maybe we can start over here.
Hi, just listening to you talk, there's a lot of talk about nurses just getting on with it and talking up, which is great. But I'm just curious, what's APNA doing coming at it from a different level in terms of connecting with College of GPs to really build that focus on team-based care in terms of those building blocks?
It's a great question. Karen, do you want me to take that or to you? So Tony mentioned a great word before, and that was alliances. And we've been so busy building as an organisation that we haven't always been as good at looking at where our natural alliances can be. And it's not that we don't talk to those organisations. Karen, other members of the board, a lot of people in this room are very good at keeping very strong links with them. I don't think we've been as forthright or maybe even as demanding. And God forbid nurses were demanding of something. For our patients, sure, but for ourselves, not so great. And I think that APNA has sometimes reflected that as well. So we've got a plan over the next couple of years setting up the campaign for the final third and fourth year to make sure we've got very strong alliances with very key organisations. Some of them other healthcare professional organisations, some of them actually patient organisations, because patients love us. We all know they love us. They give us a hard time sometimes, but they love us. And often we don't actually have the patients who care is meant to be centred around, actually having a strong policy voice saying, well, actually, you know what, sometimes I just want to see a nurse, and I'd prefer to sometimes as well, because that's going to help us have a better policy discussion when we go to government as well. Thank you.
Ken, I might just add to that. You're probably not aware, and we do try to publicise it, but the College of GPs has one of our members on a great number of their committees, so the accreditation standards, all of those books that you get in practices, the accreditation standards, infection control, SNAP, all of their preventative health publications. We have nurses on committees that help to contribute to that. We have nurse Janice Lyons, who is on participating in a big public health promotional activity that the government is funded for the College of GPs to do. So usually if they have a big activity, they will come to us and ask for a nurse expert to advise on those committees. And as Ken said, probably we need to ramp up, and we aim to ramp up that, I suppose, higher profile and media connectedness with the college at some point over the next 12 months.
Right. Sam Moses.
Hi, thanks. I love the panel. Everyone's amazing. You're all amazing. Tracy, I was just really curious to know, in the review that you did and the research where you got to travel the world and see some different models of care, was there any particular model that stood out to you that you see Australia being able to adopt? Is there something that you saw that really... I've heard about clinics in, say, South Africa, for example, where it's basically their nurse clinics. There is a doctor, because, of course, doctors are always a very important part of everything that we do. But the patients were coming in, they were seeing the nurses had prescribing rights for different things, some antibiotics and different things, and the patient did only go and see the doctor when it was necessary, because one of the strongest things that I'm hearing is, and we all know, that patients don't necessarily need to see a doctor all the time, but it's just because of the way we're set up that this is how it happens. So I'm just wondering, did you see... Was there anything in particular that stood out to you that is going to be a nice, easier way for us to try and move forward with all these changes that we really want to make by 2022?
So in 10.5 weeks, it's hard to summarise, was there one model? No, there wasn't. Were there themes? Absolutely. So I think the notion of teams of care, so whether, there's all sorts of ways that can occur, but teams of care is happening around the world in ways that it's not happening in Australia. That's a big frustration for me. What does that result in? It results in GPs stopping being these little mice. I was in conversation with someone yesterday, and they'd been in a GP practice that morning, and the day hadn't even finished, and that GP had already seen 65 patients. How soul destroying. That's not seeing patients, that's skipping over them. That's not care, that's billing. And I don't think GPs like that any more than anyone else does. So one of the interesting conversations that I had in Pittsburgh, which is in Pennsylvania in the United States, was with this amazing family physician, which is sort of the American version of a GP. And he said, I stopped doing that mouse thing some years ago because we embraced team-based care. And so I now only see patients for a minimum of half an hour, only when those patients need a full workup, lots of management planning, lots of differential diagnosis, and I get the right amount of time to really be able to do that. And sitting in on that consultation is all of the relevant players who've been keeping that patient well, keeping that patient out of hospital the rest of the time. I think the other thing that we need to come to grips with in this country is what we're doing around patients of rapidly escalating risk, and how do we stop patients getting back into hospital or discharging them earlier. There is no conversation in this country around that integration that we need to make sure that patients are coming out of hospital faster, and when they're out of hospital, they're staying out of hospital. And that's because our systems don't particularly talk to each other. There's no incentives, whereas in most other parts of the world that I visited, and I visited, 6 different countries and jurisdictions, they have different performance indicators around 30-day readmission rates, 60-day readmission rates, whatever, and a whole planning process around where patients are going as they transition in care. So the Productivity Commission in November 2017, I think it was, sort of said we need to be investing 2 to 3% of the current hospital budget in integrated care initiatives. If we get that sort of access to money, and the Productivity Commission is a bunch of economists like me, we will all of a sudden be able to see what the multiplier effect is of team-based care, integration, and more proactive care. And they're the themes that I'm really embracing.
Fantastic. Thank you for that. Final question.
Great. My name is Chris Picton. I'm the Shadow Health Minister here in South Australia. Acknowledge that most of the levers in terms of primary health care and nursing will be at the federal level, but from a state government perspective, are there things that you think state governments can be doing to promote primary healthcare nursing? And I guess thinking, we've got a panellist from Sexual Health Services, which, unfortunately here in South Australia we're seeing some reduction in that area. Also thinking here in South Australia, probably about 10 years ago, we had some grants that were going to practices to encourage them to employ more nurses. But obviously there's probably things that public hospitals could be doing as well to encourage primary healthcare connections as well. So do you have any thoughts on what state governments should be doing?
I might grab a little bit. I'm about to set up my second nurse-led clinic within my community with no money from anybody. Show me the money. We need some money, and I don't mean pay me. I believe that once we're recognised and again meet our tertiary counterparts, perhaps some funding will be thrown our way a little bit. My life and self-esteem and encouragement to continue with what I've been doing has been so well supported by APNA, especially Lisa and Beck, by being part of a mentoring program, and my mentor Danny is here today. You need kindness, you need encouragement, you need recognition, and I'm sorry, but we do need some cash because we can't provide amazing services without the products we require to give that high level of care for patients. So the new project that I'm working on with one of our GPs is we're providing a specialised skin cancer service within general practice in our remote rural area. So by cutting out melanomas, and we have at least one a week at this stage, we're reducing hospital admissions. The patient does not require a general anaesthetic. They don't take up a hospital bed. There's not that 2-hour drive to the nearest tertiary hospital. That takes a huge pressure off the hospital services. But the billing that my GP can do is not anywhere near the same amount of money that's thrown at a tertiary institution. I'm not a very political person, but I grew up in a household with 2 aunties who were born with full spastic quadriplegia from cerebral palsy. My grandparents had all of their support and income from their community, from fundraisers, from any little bits and pieces that people gave them support for. And they drove community events, and wouldn't it be wonderful if we could just focus on caring for our patients instead of worrying about how to get money for that as well? Money! Money, money!
And Tony, I suspect you've got a bit to add here.
Yeah, so I think there's a structural element here. So primary health networks working with their local health network or local health district in New South Wales, actually collaboratively looking at what are the needs of the local community, what can we do together and invest together, because sharing the risk and sharing the opportunity is really important, and that can actually drive that collaborative approach really strongly. And just a really quick example of that is something called a GRACE model. So this is where a major hospital outreaches into a residential aged care facility. and does a couple of things. So first of all, it builds capacity and capability and confidence of the workers in that facility to actually work to their full scope of practice, so that they're not feeling disempowered and people end up in your emergency services unnecessarily. If indeed that person does need to go to that hospital, they're triaged with a senior nurse who looks after them and actually facilitates their care in that hospital environment and then gets them out of hospital as quickly as possible, because we know the minute you go across that threshold, elderly people, particularly if there's any cognitive impairment, do very poorly. And the funding and the working of that is actually a shared responsibility. It's a really good example of how state government and community care can actually work together to better provide services for a very frail and difficult cohort of people to look after.
And I'd also say, keep doing what you're doing. Ask nurses some of these questions, because for too long, nurses haven't been asked. And I think with my policy background coming into play, I'd say you're either at the table or you're on the table. And I think we've been on the table quite a lot as a profession, and we certainly want to be out there now. And we appreciate you actually taking the time to ask the questions, and we need more of that in health policy. We are just about on time, and I know we could keep this conversation going. And for those who want to know more about the campaign, I'll tell you a little bit more before we finish for the break. We've got a concurrent session running where we're going to go into more detail about this, but we're going to do one thing right now. I'm going to keep the panel here for a bit so they can see what hopefully will be a bit of movement. We're actually going to give you something to help you get involved with the campaign. And while that something is coming around, I'd like you all to take out your phones. Phones are a very powerful thing, but what we're going to ask you to do now is also a very powerful thing, and that is, we'd like you to bring up the APNA website. While you're doing that, I'll tell you why we're going to do that. And that's because you've seen campaigns before for all kinds of things, but it doesn't mean anything unless we have people who are actively supporting it. So we're going to ask you, while you're here, to pledge to actually be part of Nurse 2022. Now the pledge, because you always should read the fine print before you pledge or sign anything. Very, very important. So the first one, and it's actually one of those deceptively small things to say. It's only a few words, but it is to take charge of your career. And what we mean by that is actually you do things like starting to plan your CPD. If you are in a workplace like a general practice, that you don't assume that the general practice insurance covers you and what you're doing. You actually look at that insurance certificate, or you buy that professional indemnity insurance, and you don't leave yourself exposed. We've got a number of things that are within that pledge about taking charge of your career. The second one is to promote the value of your role. And if I could destroy one entire sentence in the English language, it would be, I'm just a nurse. Let's stop using that. Let's leave this room today and actually tell others to stop using that phrase. We're not just nurses. We are nurses. We are a registered, accredited health profession, and we need to make sure that we don't inadvertently run it down or chip away at its standing. The third one, which is also really important, is to make sure that you don't feel isolated. And that means supporting your profession and making sure that you are networking in, that you don't feel alone, that you don't feel that there aren't others who you can talk to about the challenges of being a nurse. And making sure that in doing so, you're supporting yourself and also your profession. Most of you would have received the folder here. Now, the folder is empty. The folder doesn't do anything, you do something. So what we're going to ask you to do is pledge on the APNA website. What that means is we can keep sending you materials to support you, keep you posted on the campaign. But what we also want you to do is, once you've pledged, we want you to go to the APNA conference stand, where we're going to get you to take a photo with your pledge. We're going to get you to get that photo, and we're going to get you to put it on a map of Australia so you can see all the nurses across Australia and where they are, and that they have also signed up for that pledge. And that's going to be the start of something that is just a nucleus here today, but is going to lead to the launch to the broader nursing population next month. It's going to build on, for those of you who know about the Nursing Now campaign, it's actually encompassing that and then taking it further, so it builds on the momentum that that campaign is developing as well. And we're going to help you make those changes in your daily practice, so that you can be prepared for 2022, when we would have actually done a whole heap of work in the environment to start changing those policy settings that actually mean we often aren't able to work to our full scope of practice. So I'd love to do one thing now. I'm going to get someone in the room who's actually taller than me, which is Steph, and there's not many of them, but I'm going to get Steph up on the stage now. She's got her phone. I actually want you to, you'll notice on the back of the folders that we've actually got Nurse 2022 on them, and we just want to actually use one photo for the start of the campaign next month, and we want everyone holding those folders up high. We want everyone... That looks amazing from up here.
It is amazing.
It looks phenomenal. And I'm going to get a few photos from the front. We're also going to make sure that after this isn't the last time you hear about this. This isn't a thought bubble. It's not one idea. It is the start of something that is going to go on for 4 years. It's the first time APNA, as an 18-year-old organisation, has ever drawn a line in the sand and said, actually, in 4 years, we want to achieve this. And we're going to start telling you more and more about that. We're going to come back every year and refresh the campaign based on what we've achieved. It starts with you. APNA is going to support you, and we're going to create some significant change in the policy environment to allow you to work to your full scope of practice. Visible, valued, respected. I want you to remember those because you deserve that. You may have one of them, you may have two of them. If you've got three, we want to hear from you because we want to know how you got there. But valued, visible, respected. It's so important for our profession and it's so important for the health of Australia. Thank you.
All right.
A huge round of applause for our brilliant panel. Weren't they amazing? Thank you, Ken, for running it. This is so exciting. Are you excited? Because last year there was Nurse Force, right? And that was a concept, but now we have a vehicle, we have a strategy, we have something to aim for. And it is valued, visible, respected. Say it after me. No, say it with me. Valued, visible, respected. And you've got to make your own plan here. Plan for you as an individual, plan for you as an organisation. You're going to create change. And we've got this here, I'll show you. Hang on. I just can't handle everything at once. So you go to the APNA stand and you get your photo taken and you'll be on that big map of Australia. You go to the APNA stand and you make your pledge. You say, what am I going to do as an individual? What am I going to do as part of the team? What am I going to do as an organisation to make these changes happen, to be more valued, more visible? And you need to be. You know, last year I told you my parents' clinic, I'd never met a nurse, and I meant to meet one in the year since last year, but I still haven't met a nurse. And we wait for about an hour and a half to see the GP, and most of it the nurse could have helped us with. So I promise that I'm going to go and introduce myself to a nurse, but if only the clinics would just say, do you want to meet a nurse? And then we'd go, yeah, that'd be great. We'd love to. We'd love to meet a nurse. So in morning tea, grab your morning tea, go to the APNA stand. What are you going to do? You're going to pledge. And then you're going to plan. And I was a teacher once and I'm terrible, aren't I? So I'm not going to nag you. I always sound like I'm trying to, like facilitate, but I sound like a nag. But have a great break. And, this is going to be such an exciting 4 years. Change will happen. You will have a voice. And congratulations on you all for the start of a brilliant conference. Enjoy yourselves. Go to the exhibition. Go to the APNA stand and have your photos taken. Round of applause. Thank you for you all. Thank you.